Greetings and welcome to CE Institute. My name is Selena Belisle. I am the founder and one of the cupping instructors here. And in this brief video, I'm going to review this article that was published in Massage Magazine that I authored back in 2021, defining what orthopedic cupping massage is. Now, orthopedic cupping massage is a distinct form of body work, which we coined here at the school. And we're going to show you the criteria of what we feel would be inclusionary to say whether you're practicing orthopedic cupping massage or not. Now, this is part of a training unit with our 12 CE hour orthopedic cupping massage home study course. So during this 10 points that I'm going to review with you, you might hear me say, I'm going to teach you this or that. That's part of the 12 CE hour course. If you want to take the 12 CE hour course where I'm teaching all of these fabulous things, please register for our training at ceinstitute.com. We have a 12 CE hour orthopedic cupping massage course there. And if you just want to hear what we feel the 10 points are that create orthopedic cupping, what we're aiming for, this is the free video for you to learn just that. So as a retired professional athlete who works on many other pro athletes, and with the 2016 Rio Olympics and the 2012 Olympics that kind of introduced these cupping marks to the world, I used a list of 10 points that develop the criteria of orthopedic cupping massage as if we're on a scorecard and trying to get a 10 out of 10 for professional athletics. So let's review the 10 points that make up orthopedic cupping massage and define what you're going to learn about and practice. In orthopedic cupping massage, we are going to practice with human anatomy, Western defined muscles, insertion to origin and back. Sometimes we're working with fiber, sometimes cross fiber, and a variety of skillful applications with the cups. We're not going to just do stationary cups over meridian points, which is an Eastern philosophy and different than our Western orthopedic cupping musculoskeletal application. In Eastern cupping practices, such as traditional Chinese medicine, the cups are placed on meridians to affect energetic balances within the body. And we are not attempting to influence energy within the body. Our goal with musculoskeletal cupping is to increase circulation to the soft tissues, to decrease tension, increase range of motion, and more. In orthopedic cupping massage, we usually use these air-valved cups with a pump, and the pump controls how much suction you can achieve with the cup or place on the client. You can also use the air valve to immediately release the suction without ripping the cup off from the client's skin. So in orthopedic cupping, we can use a variety of pressures and intensities for client comfort. Now, regular Eastern cupping is practiced all over the place. You could go to the beach and there might be stools there where you would literally sit as a client and somebody might cup you at the beach, which is kind of cool. And they come to your hotel, they'll work on you in your bed and more in China and other countries too. But orthopedic cupping is also used similarly in the Western civilized nations and countries here. We use cups at sporting events and on-the-go settings, which we saw at the Olympics for, every period since 2012 at least. Some of these cupping sets are in like these briefcase carry items that you can just carry to your sporting event. And you can work on clients while they're seated in a regular chair. I would have the chair turned around and have them straddle the chair. And if they have like lower leg fatigue, they need increased circulation, increased tension, maybe shin splints or something like that, and they just need, without inflammation, they need a distraction. You want to increase circulation in the area. You can literally put your athlete on the ground with, again, a folding chair and have them flex their hip, flex their knee, and place that shin straight. Let them rest the calf on that folding chair, on the seat of the folding chair. And you can cup up and down on that lower leg. So cupping is really adaptable. I had one person who had frozen shoulder once, and they couldn't lie on a massage table, but he could sit in a chair. It was actually a doctor. So, there's many different ways you can adapt cupping. It's not just a table treatment. And here's some wonderful seated examples of cupping work. So orthopedic cupping is including, and it's an inclusion of this. Now, on the image on the right, that's excessively cupping. There's no need to apply that many cups to one individual at any time. Now, I love using orthopedic cupping to treat musculoskeletal dysfunction or disease. Now, when you have somebody like a scoliosis, which is pictured here, you would want to cup that upper right shoulder because it's elevated, and you want to try and stretch the soft tissue of that right shoulder wherever it might be contracted, as long as it's functional scoliosis. If it's structural scoliosis, there's no amount of stretching the tissue that's going to help, right? But if you have a functional scoliosis where releasing the tension might help bring the spine into balance and make it straighter, you would cup the upper right shoulder, and then you would cup the inside C of the S of the scoliotic curve near that left rhomboid area and the left lower trapezius. And then you would cup again on the inside C around the thoracolumbar fascia on the right hand side of the spine, and also just above the right ilium. This is the medical treatment I would provide in orthopedic cupping if somebody came to me with this type of scoliosis. And you can also apply orthopedic cupping to things such as tennis elbow and other physical disorders that might be improved through increased circulation, increased range of motion, and a reduction in tension within the muscle. The nice thing about orthopedic cupping and cupping in general, and it falls within the general guidelines of cupping, is we are creating reverse suction, okay, reverse pressure. And have any of you been massaging or treating a client for a really long time and they're annoyed because they love the way they feel after your service, but they have to come back again to feel better again? And they have to keep on coming back. It's not a one-time fix. Just like if you diet and lose all this weight, but you start eating again, you're going to gain all your weight back, right? It's something that is continually ongoing. You exercise and get really fit, but then you sit on the couch for a year and you're not fit anymore. We continue to age and we continue to deteriorate, right? So usually when somebody has bad postural alignment or bad habits with their body, or overuse injuries and so forth at work, which they're not quitting, they are going to need to come back and regularly see you. And to stop people from feeling like they're wasting their time or their money, sometimes it's good to break up the treatment that you're providing them. I don't think there's ever anything that's going to be forever curative when it comes to musculoskeletal ailments. Especially when posture is involved and the posture isn't addressed. But, when you provide this reverse suction as opposed to deep tissue work week after week, this week we're going to go in the opposite direction. We're going to do reverse pressure on your tissues. That gives an alternative to your client so they feel like you're doing something new, and it might be longer lasting for them. You never know. I'm going to give you an example. We had the CEO of an insurance company who's coming to our office every week religiously. And he'd come in on Mondays because he'd golf all weekend after working, 50, 60-hour weeks of holding a phone between his shoulder and his ear. This is before we had headsets back in the 80s and 90s to talk on the phone, right? So he was annoyed after 2 years of weekly, every Monday service, 90-minute massage. And he stopped coming to us for about a month. And I was on the second floor of this main location where we had this practice, this alternative health practice. And one day we heard like a knock, knock, knock. We heard the door open and close, but nobody came in. And the door only opened to our practice, so it was kind of weird. But we could hear something on the stairs, and it was really weird. This 50-year-old executive climbed up our stairs on his hands and knees after a month without his weekly massage. He had deteriorated so rapidly within a month that he realized he needed that weekly massage. So, what probably would have been best for us is to try and switch it up and get him to try other modalities, seeing he was frustrated that he was having to come in weekly so that he could actually walk into work and walk out of work and so forth. He didn't want to give up his golf. He wasn't going to start working excessive hours and have bad habits at work. But, he was coming to see us. We were keeping him functional. He was able to play 36 rounds of golf on the weekends after working all week. And orthopedic cupping really has its place. I don't think he wanted to try alternative modalities. He refused acupuncture we had at our clinic. He refused chiropractic care we had at our clinic. But I think if we would have had this term orthopedic cupping back then instead of just cupping, he might have been more open to that. Now, orthopedic cupping can also be applied in really difficult areas to work. How many of you guys who are doing massage all the time, how many of you have pain in your thenar eminence, in and around your thumb and your saddle joint in there? Now, it's very difficult to do deep tissue work, or heaven forbid you get a trigger point in there. My goodness, that would hurt. But you can cup that. And I'm going to show you a demonstration of doing cupping work there. Not only is it easier for you to practice as the therapist, as the practitioner, but it's highly effective too. Now, in Eastern cupping, they usually just place the cup stationary and they just sit there on the meridian points. But in orthopedic cupping, we're actually manipulating the cups to stretch the underlying soft tissue, including the skin. We want to increase range of motion. That's one of the goals in orthopedic cupping. Now, if somebody's already double jointed and hyperflexible, we're not attempting to stretch the soft tissues even further. But somebody who's lost range of motion, cupping is extremely effective in increasing range of motion. There's several research studies that show an increase of range of motion, and we're going to demonstrate some of those researched hands-on protocols to increase range of motion with orthopedic cupping as well. Because the cups are constantly moving in orthopedic cupping, we are almost emulating skin rolling, myofascial skin rolling, except with myofascial skin rolling, I feel like we're really only getting the local focal area of the skin and maybe some of the superficial fascia. In cupping maneuvers, and the orthopedic cupping maneuvers I'm going to demonstrate with you and have you practice, I feel like you're also getting some of the more superficial deep fascia and definitely some of the muscle fiber up into that cup as well. I feel like you're increasing circulation, not only in the superficial way that you might achieve with skin rolling, and cupping is very similar to skin rolling, but it's a deeper therapy than what myofascial skin rolling can achieve. In the orthopedic cupping that I'm teaching here at CE Institute, we're really trying to affect fascia. So the superficial fascia and the deep fascia, which encases all muscles, bones, tendons, ligaments. Not only are we trying to separate some of the fascial tendrils and make them thinner and more flexible, we want to increase circulation in addition to increase range of motion and more. So when we do our full body myofascial decompression, this is the order that we cup the body in that full body treatment. We start up the front of the legs and then the quadriceps. And then we do the anterior shoulders, like the chest cavity, the anterior deltoids. And we go over the head, we roll the client over into pronated position, and in the back, we're trying to pull down those shoulders. In orthopedic cupping, it's almost like a neuromuscular therapy approach where we want to create better body alignment, more normal anatomical alignment of the body, which when people have rounded shoulders and hyperlordosis and so forth, they tends to create pain, aches, pains, dysfunction, and more. So we are trying to realign the body into a normal anatomical state. And that's one of the things we're attempting to achieve with our myofascial decompression treatments. Our myofascial decompression is going to be, and orthopedic cupping in general, is going to be very different than traditional cupping practices, where you usually just throw some cups on and leave them there. We are going to manipulate soft tissue with some fairly skilled application, and we're going to work on Western anatomy to achieve this. Another total win for orthopedic cupping is we have less marks than traditional cupping. In traditional cupping, they'd place a cup usually over a meridian point and let it sit there for on average probably around 20 minutes. And that's going to leave a mark for most clients. Now, in orthopedic cupping, we are manipulating the soft tissue, the underlying soft tissue. And it usually feels more intense than a stationary cup just sitting there, but we spend a lot less time manipulating over the area. So it's usually not long enough to really mark the client unless they have really poor circulation or other issues going on. Some people mark easily, some people don't mark at all. But if you compare the same client, if you did stationary cupping on them 1 month and our orthopedic cupping on them the next month, 20 minutes each, you would find that they're probably going to be a lot less marked with the orthopedic cupping modality that you're learning here. Now, learning all of your meridians and how to apply cupping in a traditional Chinese medicine sense or in any other national medicine that's been practiced for centuries can take a lot of time. Traditional Chinese medicine doctors usually are practicing and training for 10 years before they earn their doctorate in TCM, where we're going to teach orthopedic cupping in 12 CE hours. And you'll literally be manipulating soft tissue with all these orthopedic maneuvers at the end of our 12 CE hour training. If you practice fire cupping with the traditional cupping methods, that can be out of the scope of practice for some licensed professionals. The National Board for Therapeutic Massage and Bodywork does not allow fire cupping as part of their subject matter because they say using fire is not within the scope of practice of a licensed massage therapist. And I think there's some states now that no longer allow cupping for licensed massage therapist practice either. So not only is orthopedic cupping within the scope of practice for most licensed massage therapists, but it's the most appropriate practice for autonomous practicing therapists. So, physical therapists, occupational therapists, licensed massage therapists, nurses who are practicing autonomously. You usually do not need a doctor to oversee you, but you should check your own scope of practice before doing any type of work to the public for payment. You always want to make sure you're practicing within your license scope. However, soft tissue manipulation with a tool, and that's what we are doing in this orthopedic cupping training. We are manipulating soft tissue with a tool, which is a cup. As long as you're allowed to manipulate soft tissue with a tool, we're not using fire here, and it's very easy to learn. You don't have to spend, a year or longer learning meridians and so forth. Most of you, nurses, PTs, OTs, MTs, and more, already know your anatomy. You went to school for this, you learned it, and applying cups to it is fairly easy. So those are the 10 points that we feel defines orthopedic cupping massage, what we're teaching and practicing here at CE Institute. Now, I'm sure you want to see all these orthopedic maneuvers and more. We show those in our training at the school. So if you want to learn more, we'd love for you to join us. Please come visit us at ceinstitute.com, where we teach live in-person training, live webinars, and pre-recorded home study with training units like this one. When we do practice or do teach the home study longer courses, the paid ones online at our school, you will visualize and watch instructor demonstrations of these hands-on practices, and sometimes we have student practice a long time with a video and more above and beyond what we're showing for free here on YouTube for you. But we hope this has been educational, that you love it, that you want to practice more, and that you come see us to practice some more as well. Please like us on our social media so that we can continue to post more free videos like this one, and so that you're also notified if we are able to post more. You'll get some notices and hopefully be able to view more as well. Until we see you in another training, be safe.